Hi, everyone. This is Dr. Mirastani, and today I want to discuss some very, very fascinating fields of science and medicine, and one in particular that's gaining a lot of traction, a lot of attention right now in social media and tons of celebrity circles, and that's stem cell therapy. And as an MD, as a doctor in the field of anti-aging medicine, I feel like it's appropriate for me to talk about the subject where a lot of people are not experts in the field and they're giving you opinions. Some people know a little bit about it, but a lot of people have not actually studied it or applied it with patients. They can't actually give you real results or real stories about how it's helped their patients. I can definitely do that. And I want to share what I have seen and witnessed over the several years. And so, first of all, I want to just put a blanket statement out there that a lot of stem cell therapy in the United States is based on marketing and hype, smoke and mirrors, based on the hope and aspiration that stem cells will help, but not actually based on clinical data. So, given that blanket statement, you have to realize that it's the wild, wild west. Stem cells are an emerging field. So, we are just learning what is clinically useful, what actually works in what diseases, what kind of stem cells. There are different types of stem cells. And what is the right price point? Because in the United States, a lot of places are selling basically amniotic fluid, and they have fancy words for it. They call it cell culture, graft of amniotic cells of cell line. But meanwhile, this is basically just amniotic fluid. Amniotic fluid has some stem cells, but very, very small amount. And so you got to be careful, because if someone says, "Oh, this is amniotic fluid-based stem cells," and there's 100,000 cells in this 2 cc's of fluid, you have to ask, well, that's a cell counter to check that, but is it actual, what type of 100,000 cells are there? Because normally that might only have 3,000 stem cells and 97,000 fibrous cells. So basically, or 97 million. So you have to basically pay attention to what is in the product. Typically speaking, broadly speaking, amniotic fluid is not a great source of stem cells. So, and in the United States, if you go to an excellent orthopedic surgeon or plastic surgeon, they will sometimes take and derive stem cells from your fat, from your adipose tissue around your stomach, or the fat around the outside of the butt area, the glutes, and they will spin that down, process it, filter that, and inject that into different parts of your body. It can really aid in healing from facial reconstructive scars, from burns. There's a very good plastic surgeon, Dr. Randy Miller at the University of Miami, that has incredible before and after pictures using stem cells to reduce scar formation and improve healing. Also, you can do stem cells and put them in joints. From a joint standpoint, I have a lot of patients that have told me that they are remarkably improved with stem cells in the United States. But I think there's some limitations to that. Me and several doctors decided to form a little coalition, and the doctors that I work with are very prestigious doctors from Johns Hopkins, Harvard, Princeton, Stanford, and these doctors decided to, try to vet these stem cell clinics and approaches using real data and looking at all the PubMed literature database to decide what stem cells actually work. And in the United States, deriving stem cells from your fat or from your pelvis, your bone marrow, and injecting that into your joints doesn't have the best data. It may be 50-50 that it helps your joints. So then there were other pioneering doctors that said, well, what if we used higher doses of stem cells? I'm just throwing numbers out there, but let's say if I were to take stem cells from your fat, I would obtain 30,000 stem cells. Well, what if we used, instead of 30,000, 20 million stem cells and put those into a joint? Would that help? Because what happens is when you have stem cells from yourself, which is autologous, or from another person, allogeniec, like a placenta, when you put those stem cells into a joint, the stem cells are not going to regenerate cartilage, but they will significantly cool off inflammation in the joint, and then your joint feels significantly better, and then your body is able to heal itself. So, like, for example, partial tears of tendons, like let's say you have one of your rotator cuffs back here that's partially torn, stem cells and PRP even are shown to improve the healing time of those partial tears. But they don't regenerate the tissue themselves. They just cool off the inflammation. So if you get 30,000 cells in your joint versus 20 million, Which is better? Well, per the data that exists, it seems like the 20 million or the higher dose placental stem cells are more effective. So the few doctors that are actually paying attention to the data are saying, if you can afford to, go overseas, because the regulation in the United States is so tight that you can't use placental stem cells. And just to clarify, once a woman delivers her baby successfully, they then collect the placenta, which is typically discarded, and they spin it down and get stem cells. And only like 1 in 10 placentas make this process. They're very picky. The placentas are processed in US laboratories for the most part, and then the stem cells are shipped in little cryo chambers on a plane to the overseas location where the US-based doctors typically will meet the patients and administer stem cells into the joints and intravenously for certain conditions, depending on what they have. And the data seems more robust with placental stem cells. Now, you can get placental stem cells from anywhere from $10,000 to $30,000 per 100 million. And these stem cells obtained from placentas are cloned up to 5 times. They're cloned to increase tissue counts. And I think when you clone past that, you lose viability and quality of the cells. So the point is that placental stem cells are probably one of the most popular ones. There's a famous video with Mel Gibson in which you can talk. You can Google this, but Google Mel Gibson stem cells, Panama. So Mel Gibson's father was 92-year-old, and I believe he was at the Mayo Clinic, and he was dying actively under hospice care. And he had, I think, heart failure, liver failure, kidney failure, and his hip was so bad he couldn't get out of bed. So he was bedbound. Hospice was on board. He was actively dying. And Mel Gibson flew him to Panama. And he got 100 million stem cells, I believe, IV. And then I don't know how many, maybe 20 million in his hip, placentally derived stem cells. And within months, he was out of bed, heart, lung, kidneys, all improved. On follow-up, I believe he was 99 years old and remarkably improved, which is a miracle. So placental stem cells can really rejuvenate and help people heal. Then the most advanced stem cells that I've seen are autologous stem cells, which is your own stem cells, taken out of your body through lipoaspiration and then cloned and grown to hundreds of millions. That process is also done outside the United States, typically by US doctors. And then there's only 1 or 2 doctors in the world that I've known of that can actually train your own immune system, your lymphocytes, to actually go to certain parts of your body to prime those parts of the body to accept the stem cells and engraft the stem cells into tissue and actually regenerate tissue. And that's a very new phenomenon that's just been published over the last year or two by only a handful of doctors. And I know firsthand, we had a patient that was paralyzed for 5 years, a T5, thoracic T5 level down in a wheelchair, young kid at 22 years old, paralyzed for the last 5 years of his life. His legs are pretty much completely atrophied and weak from lack of ability to move. And he can't lift any toe of any one of his feet. He just can't do anything from the waist down. And they actually, he was from the Hamptons, and they actually did a GoFundMe, and they gathered $50,000. They shipped this gentleman down to South America to this location where we have a group of super elite doctors that then took his own stem cells, took his lymphocytes, primed lymphocytes, injected lymphocytes, then injected stem cells, and regrew his spinal cord. And now he's walking. And he's actually on my Instagram walking, which is insane. I think he's the 110th patient they have done in the last several years, which is insane. This is something that needs to be pushed through regulation in the US as fast as possible. And the reason we can't do this in the US, just to be clear, is because the US has such strict regulation. It's like everything has to go through phase 1, phase 2, phase 3 drug trials, basically, which costs about $1 billion. The average drug, especially an oncology drug, takes over $1 billion to fund phase 1, phase 2, and phase 3 trials. So a lot of these things that we're doing, because we're manipulating our own cells and we can't patent the product, who's going to fund $1 billion venture or study if you can't guarantee that you're going to make the money back? And that's part of the issue. The regulatory status in the United States is limiting stem cell, development, which is really sad. But at the end of the day, we know that we can heal people of crazy diseases using stem cells. There's lots of different options. I just wanted you guys to know about a couple of them. And there's another thing called a T-cell vaccine, which is fascinating for anyone that has autoimmune disease. So autoimmune disease is obviously rampant in the United States. Hashimoto's or thyroid autoimmune disease is the most common. There's a ton of other ones: eczema, skin condition, psoriasis, skin condition, ulcerative colitis and Crohn's disease, when the gut gets destroyed, lupus, psoriatic arthritis, polymyalgia rheumatica, rheumatoid arthritis, and the list goes on and on. Systemic sclerosis, scleroderma, Raynaud's. The point is that we're having an increased prevalence of autoimmune disease, and we think the reason that is because our environment is becoming a little bit more toxic. We have more toxins, and then we have more maybe GMO foods and more and things that are unnaturally stimulating our immune system. And if our immune system gets stimulated enough, we can make auto antibodies or autoimmunity. And so now that we have more immune disease, what can we do? And of course, there's lots of different medicines. There are biologic medications like Humira and Enbrel. These medicines that calm down TNF alpha and other cytokines, and they really do work. They're very effective. But long term, if you're on these medicines, you have a slightly increased risk for certain cancers because it can affect that part of the immune system that also protects you against cancer. So what if there was a better option for long-term treatment? So T-cell vaccine is genius. Basically, I think it was created in the 90s. A doctor figured out that if you take a patient that has autoimmune disease and you do apheresis, you basically put a big IV in their arm and you filter their blood, you remove the problematic antibodies. Then you take those antibodies and you actually grow them counterintuitively. Then you radiate them, making them inert. And then you inject large boluses of those antigens, even though they don't do anything, into your bloodstream, and your immune system sees this huge antigenic load of unknown things coming in. It creates antibodies against them because they're not supposed to be there. And then in creating antibodies against the very antibodies that are destroying your body, which is amazing, you now have created a vaccine against the bad antibodies. And so over time, over multiple injections, maybe 10 or 12 months, doing an injection once a month, your body stops in its tracks. It kills the bad guys. And it's such a simple solution, and it seems almost too good to be true, but we have sent multiple patients down to South America to get this treatment done, and they are completely cured, which is massive. And I'm going to interview one soon. Her name is Rose Marie. She was my first patient to go down. She had 2 different autoimmune diseases, so this is really remarkable to see her get better. And the point is that we do have emerging technologies that need to be discovered and need to be put in media. We need people to know these exist. Hopefully one day we'll have regulatory agencies that can fund trials. Maybe the government can fund $1 billion trial. But until then, people can still get these therapies. They just have to go to other countries. So for now, we will continue providing you with updated information on different available technologies. And I hope you guys have a wonderful rest of your day and your rest of your week. God bless.